Hey everybody, thank you so much for joining our weekly COVID-19 webinar. We have an amazing set of panelists today to talk to you about this specific topic that we'll get into in just a minute. I wanted to let everybody know that Best Friends is hosting webinars every Thursday, this same time. So it's 6 o'clock Eastern time, 3 o'clock Pacific. We are going to have different topics, things that are obviously right now going to be very COVID specific. And this is going to be happening for the unforeseeable future. You know, we need to get together. We need to be talking about things. Things are changing so much. And with the webinar today, I want to, if you didn't know, it's National Animal Control Officer Appreciation Week. So it makes total sense. And there's a lot of great information, whether you're associated with animal services, if you're an officer, or even if you're a rescue or a volunteer, you're going to dig into some really cool stuff, get some really good perspective from these great panelists. You're seeing the great pictures of all these people. That first guy with kittens all over me, that's me. My name is Mark Peralta. I work for Best Friends. We are also going to be adding in every week as much as we can, because there's so much information coming at all of us day to day. Dr. Erin Contribe is our medical director here at Best Friends. She is also embedded as a medical director at Palm Valley Animal Society, and that is about a 25,000 intake shelter that's in Hidalgo County, Texas, so about as far south almost as you can go in the state. And she is also embedded as a medical director there, so she's working with, you know, a very high intake, but very low resourced in regards to budget shelter, along with being the medical director right now. And Dr. Erin is constantly and willing to come on these briefly to kind of give us a really good update of anything that's changing with the CDC. So we'll start with her. Of course, you cannot, for us at Best Friends, talk about animal services without my man, Scott Giacopo. Scott is the director of shelter outreach for Best Friends. He is also the president of the board of the National Animal Care and Animal Control Association, excuse me. And so we're going to get into some topics with him. We also have Christina Snow here. She is the Animal Protection Manager for Pima Animal Care Center in Tucson, Arizona. So it's going to be great to talk to her. She's in the field. She's knocking on doors, but she also has a team there that's working in Arizona and doing great things. Shannon Neal is here as well. She is the Chief Animal Control Officer there, Jefferson Parish Animal Services in Louisiana. And of course, to bring it home, we're going to also have Dr. Josh Fisher. Dr. Fisher is the director at Charlotte-Mecklenburg Animal Care and Control. So we're going to go through, we're going to spend the first half kind of giving some basic questions that we have prepared for them, and then we're going to be able to get to your questions as well. So please feel free as things go along to submit questions. We will take the end time of this webinar to go through these questions assigned and let these experts and panelists be able to take on this stuff and hopefully give you a lot of great information that you need. So again, I just want to thank you on behalf of Best Friends, our panelists, and all of the teams that are working hard to put a lot of information together to help us through this really trying and unprecedented time, and just always remembering that we're all in this together. And we're going to dig into some animal care and control content. But before we do that, let's go ahead and let's tee up our wonderful medical director for Best Friends, Dr. Erin Contribe, to start giving us some basic information of what's going on this week and what's new and what's the latest.
Awesome, thanks, Mark. Hello everyone, and so happy you're here. We really didn't see much new from the CDC this week, but I will just touch on a few things from what we've seen out of the veterinary side. Just to reiterate, still, we have no evidence that pets can transmit this disease to humans, and pets are not involved in the epidemiological spread of this disease. There was an article that came out. It was published by a University of Ottawa biologist. Honestly, it didn't get as much press as we thought it might, but I did want to go ahead and call it out in case you do come across it. So in this paper, the author claims that dogs might have served as the bridge species for transmission of this virus between a bat and humans. I just really want to be clear about this. So this study is a single author that put this out, and it's not peer reviewed, so it hasn't been validated, and it's really just centered in speculation rather than anything that's truly confirmed science. So again, still we have no evidence to suggest that dogs or any animals pose a transmission risk to people. The CDC previously released some guidelines on how shelters should handle pets from COVID positive homes if we are asked to take them in. Nothing's changed there, so still the same guidelines. I did want to call out there is some really early research being done that actually is testing pets for SARS-CoV-2 that are coming from households with positive people, some asymptomatic animals, as well as some animals that are showing signs that could be consistent with an infection. About 20 of those so far have been tested, cats and dogs, and all of those results have been negative. So again, still, I think very good news. You know, we're just trying to be cautious and actually do the research. The CDC does have some guidelines for vets, but in general, routine testing of animals is not recommended. There are some specific criteria, though, that if a vet is concerned that they can use to decide to request that test, but everything needs to be done in conjunction with the state vet or with the state public health vet. Finally, really just the biggest point I do want to still emphasize this week is making emergency plans. You know, we all know that the place for pets is not in the shelter, and especially not now during this crisis. So for your own pets, make a plan, make a backup plan, and a backup for your backup in the event that you, for some reason, become unable to care for them, particularly if it's because of COVID-related illness. And just like we've done for emergency foster, let's really message that and engage our communities to do the same.
Thank you so much for that, Dr. Aaron. And I just want to remind everybody, Dr. Aaron is going to stick on this webinar. So if you have specific questions that come into the medical field, don't feel free to submit those along with anything that comes up as we start getting into the questions with the other panelists. And we'll be able to take some time at the end here to answer questions and field these to these wonderful experts. Again, Dr. Aaron, thank you so much. And again, Dr. Aaron will be a part of these webinars, giving us great up-to-date information like she did today every Thursday when we're doing these weekly COVID webinars, Thursdays, 6 p.m. Eastern, 3 p.m. Pacific. I want to go ahead then and switch over and let's start getting into the panelists. And I would love to start with Scott Giacoppo. Again, Scott Giacoppo has a long history in the animal control field, but most specifically, he is somebody that takes the position as Director of Shelter Outreach, which we'll talk about a little bit. But before we get into that, you know, Scott also is the president of the board of NACA, which is the Animal Control Association. I don't know why I keep saying that. I'm so sorry. And Scott, how are you doing today? You there?
Yeah, I am, Mark. I am. I'm doing fantastic. Thank you.
All right, great. So Scott, I want to start off and I want to talk to you kind of, you know, as the president of the NACA board, this pandemic has obviously accelerated a lot of statements coming from you and other board members, such as Dr. Fisher, who's also on the call and excuse me, on the webinar today as a panelist. So obviously this pandemic has accelerated some of these recommendations that we're seeing out there. Can you kind of talk us through or talk about why now some statements from NACA and specific statements have come out, you know, to kind of help guide animal services and how people in the public and in the field can kind of find these statements for us?
Sure, I'd be happy to. Yeah, Mark, you know, as soon as we realized that there was a problem, you know, the pandemic was starting to grow and people were starting to get really nervous about it, we knew that animal control was going to have to continue to be out there doing their job. So the first thing we did was we issued a statement on behalf of animal control everywhere, saying to local governments that animal control, regardless of what happens, has to stay as an essential service. We have to be out there doing our jobs. And people really started taking notice of those statements, and people were using them. Local jurisdictions were giving them to their county administrators and their mayor's offices and so forth. And they started really picking up steam. And we started hearing from our membership on problems they were having. So to address those, we started coming out with even more statements. And, you know, one of the ones that in particular was we heard from officers who actually have to go into the homes of people who were removed by emergency medical teams for falling victim to COVID-19, and they were scared. And you know, we, especially at the time, we didn't know, were animals fomites, were, you know, can they catch it just by being in the house? And yet these officers, as dedicated as they were still willing to go into those homes and get those animals. So we wanted to prepare statements or guidelines per se, that what they could do to protect themselves. And we worked really closely with all of the major shelter veterinarian associations, university programs, Davis, UC Davis, University of Wisconsin, Florida, the the Association of Shelter Vets, the AVMA, CDC. We worked with everyone to find out exactly what we needed. And we've since changed that, but we did put out, a statement originally on, how to go into a home and do your job, basically removing that animal if need be. And like I said, then we had to go back and change it. They're living, breathing documents, and we are listening to what our members are saying and the concerns that they're running into out in the field. Animal control is never really seen in communities as an essential service, as the way, myself personally, and I can speak for NACA as well, the way we should. We should be seen as heroes in the community. We are. I mean, we're out there risking our own safety on a daily basis to help people and animals. And having this virus out there, it brings that to a whole new level. And now the officers are not only afraid of their own safety, but now they're afraid of bringing it home to their families. So we did include a statement on how to stay safe out in the community. So it's a lot of things. It's everything from that all the way up to asking local governor, the governors of each state to relax certain laws that would prohibit us from being able to do our jobs as effectively as we could under these circumstances. One is there are states out there where if a dog or a cat scratches or bites someone, they have to be held at the local animal control facility. They can't do what's called a home quarantine. And a lot of shelters at this point in time are trying to reduce their numbers, rightfully so. And animal control doesn't want to contribute to that. We have people who are shelter staff who are sick and on furlough. We're worried about influx of animals, so we're trying to do our part to reduce the numbers of animals coming in. So one of them, again, was reaching out to all the governors across the country, asking them to reduce or relax that requirement that they have to be impounded into the shelter for a 10-day quarantine. Now, hopefully they can do them at home, and the officer can even do a remote or a video check on that animal. And the other big one we did was in regards to, and this was really controversial, and it was controversial within our membership and our board at times, was asking the governors to relax the requirements that animals have to be sterilized before they're released. So what was happening is shelters all over the country were trying to release animals through foster and through adoption. Adoptions have skyrocketed, but because in so many places sterilization has stopped, a lot of places are being told they can't do unnecessary surgical procedures, and they deem sterilization as unnecessary. So now we're left with a bunch of unsterilized animals that can't leave the shelter because the local law mandates that they're sterilized. So we were able to work with a lot of local governments, and we issued a statement on that. And hopefully that helped in all places. I'm sure there are places where it hasn't, but we're trying to address the needs as we see them arise, and where our membership is an integral part of that. We're doing a lot of Facebook polls, and members are coming on and answering those in droves. The biggest one, though, for me, I'll be honest, and especially in honor of National Animal Care and Control Appreciation Week, was we put a question out there: what are you most afraid of? And almost every single officer, and there was a lot of people that responded, were afraid of the virus and giving it to their family. I talked to an officer who is in an age bracket that is high risk, and she's already immunocompromised, and her partner is also in a high risk age bracket, yet they're still out there doing their job. And if our communities can't appreciate that type of commitment and dedication, I don't know what to say. I mean, it was just amazing. Some of the people that I've been talking to and their commitment to this profession, it's humbling. I had the opportunity to speak at length yesterday with the officers, some officers out of New York City, and we all know, New York is the epicenter for the country, and those officers are still out there doing their job. And to me, again, it was really humbling.
Thank you, Scott. And, you guys taking a stand and really just trying to give some kind of statement and recommendation for people to work on has been tremendously helpful. So please, a nod to you and the NACA board and its membership for, moving in that direction. And whether or not people agree or not, it's just nice to see those kind of statements come out, especially in a time when all of us are really trying to, get some guidance from anywhere that we can to make really tough decisions and navigate through something that none of us are used to navigating through. Now, you brought up the guidelines a little bit, but I do want to decipher, the statements that you came out, but even before the statements, NACA also has always had guidelines, since I think I became a NACA member in 2007. And those guidelines largely kind of didn't seem to change much in the time from that until recently. But one of the things I can also see, especially with kind of what the NACA board has been working through and the leadership that's going on there, can you also talk to us in regards to the actual NACA guidelines and some of the specific things that you have taken on and changed, you and the board, and why some of these why the NACA board, the newest leadership board, has kind of been updating and releasing these longstanding NACA guidelines and changing them? And can you kind of talk to us a little bit about some of those that you've kind of updated in the past, probably what, 6 months to a year?
Yeah. Well, you're right. NACA has always had on our webpage, there's a resource page, and it does have the guidelines on, our recommendations on how certain operations should be conducted. And in my opinion, those should always be like living, breathing documents. It should always be reviewed to see what's really happening and whether or not it really reflects today's environment. And the COVID situation aside, we used to, for instance, the biggest one for me anyway was the change in stance on community CAP programs. NACA used to take the stance that a TNR program, RTF, SNR, all of that could be effective, but that each individual community, it should be up to each one of them to decide which one they should do, whether or not they should do a trap and remove, which is historically been the response to community CAPs, or do this new fangled TNR thing. But looking, we took a hard look at it, and we know that for decades and decades and decades, animal control has been trying to solve the community cat issue in the communities by trapping and removing, and we know it doesn't work. No place has it worked. If it had, we wouldn't be having this conversation. So for me, it was like, we kept looking at it and we kept doing things the same way over and over and over again, expecting different results. And we all know what that's the definition of. So the board sat down and took a look at it and said, it's time we acknowledge the fact that trap and remove doesn't work. And that right now, the only thing we've seen that does produce those results are trap, neuter, and return. Another one, and again, this goes into cats as well. There's been a longstanding support of cat licensing. And I have yet to find a place or hear of a place where, cat licensing really worked and achieved the objective. It just doesn't. So we just totally got rid of our support on cat licensing. And along that line, going back to the fact that they're living, breathing documents, we're always talking about it. I mean, there's actually a conversation going on now on whether or not we should even support dog licensing. Most places that have dog licensing in effect, it costs more to administer the program than it does generate revenue in most places. So those are the types of conversations we're having. And the same with like our adoption, our guidelines for adoptions. We updated that to reflect a more open, non-judgmental procedure in adoptions, which is more reflective of what's really happening in successful operations today across the country.
That's great, Scott. Thank you so much for that information. And I just want to give you one more question, and then we're going to move on to some of our other panelists. But I really want to talk about your work in the role that you have with Best Friends now and as the shelter outreach director. So you're on a regular basis, you're working side by side with shelters across the country. And in case you all don't know what he does, Basically, he's out training and teaching and working with agencies all over the country to help improve practices, procedures, animal control services, anywhere that will basically take us. And you and that team are grounded. You're used to being on the road. You're used to being out there all the time, and you don't know for how long anymore. So how are you and your team continuing to assist with, that kind of shelter outreach currently? And are you kind of thinking about or learning anything from this that will potentially you want to take on as looking as an ongoing approach for future work?
Yeah, and first of all, being grounded like the rest of the country, it's driving us crazy. I mean, I spend 70% of my time on flying around the country, and I think my cats finally realized that I'm not the pet sitter, and I think they want me out. But yeah, I mean, it's interesting. We are looking for different ways of still serving our those shelters out there that want the help. And we're doing a lot of phone consultations. We're doing a lot of virtual stuff. But what we're looking at now is one of the services we provide are shelter assessments, where the team will go out and we'll spend a couple of days actually immersed into that shelter and working side by side with them to see, how are they sanitizing cages? Is it the best way? What's their enrichment program like? What's their adoption procedures like? I mean, the whole 9 yards, all from from shelter and field operations as well. And what we're looking to do now is to determine how we can do that entire process remotely. And we have a couple that we're working on now that's going to be a pilot program, so to speak. But we're gonna set up video conference calls, and we may get either a staff member or a volunteer assigned to us to literally walk around the building and give us a tour of their building and walk us through their operations, all with a webcam. So we're really excited about that, and that in the long run may actually help us help more shelters. And so we're doing things like that. We're looking at how we can use modern technology to train and to teach people, what others are doing. And that's one of the things I love about my job, is that, I could be in somewhere in North Carolina today, and I see an agency doing something so fantastic. And then in a couple of days, I'm in South Texas, and a problem comes up, and I'm like, oh, hey, wow, this is how they're dealing with it up there. It's sharing that knowledge. It's not everything that I've done or that what I say is best. We're taking things that everyone around the country is doing successfully and sharing it with others around the country. And I love that aspect. And now we're trying to figure out how we can do that through digital means.
That's excellent, Scott. And thank you so much for the thoughtful responses to those questions. And I just want to remind everybody who's in attendance, please feel free to continue to ask your questions as we're going on. We will have time to address as many questions as we can. I do want to go ahead and move on to Christina Snow. She's the next panelist. Christina is the Animal Protection Manager at Pima Animal Care Center in Tucson, Arizona. And Christina, I want to ask you a question basically about managing officers in the field. So you're managing officers in the field, as I said, but yourself, you're out there knocking on doors as well. Can you kind of walk us through and talk about how the pandemic's affecting the way that you and your officers are doing your work currently? What's changing? What's different?
Yeah, I mean, it's all different. I think that as a whole, as my department, we kind of gone through a wave of emotions. I think at first we thought, everybody was overreacting, and our officer mentalities are just get out there and do our job. But we quickly realized that this is real, and we were really, going to have to modify our operations. It is just completely different. I mean, the fact that we can't have two officers sitting in a truck, the fact that you've got an entire county shut down and everybody's at home, and they see our trucks in the neighborhoods and want to come talk, and we have them approaching our trucks and have to tell them, hey, stand back. It came to the point that we had to make a flyer that we now pass out to anybody that we talk to or potentially going to communicate with that basically tells them, hey, you're reading this, we need you to stay 6 feet back. I'm wearing a mask. This is for your safety as well as mine. And do you have a phone number or email that we can communicate with? Because if there was any way we can take these complaints, or just even have the simple communication that you need to have on calls, on scene, if we can handle that over the phone or email, we're doing that. I purchased iPhones for 20 officers last week, just to give them that extra option to communicate alternatively. But it's scary. I mean, our city's pretty much shut down. We can't get in courthouses. We can't get in to do our warrants. We're having to do telephonic warrants. I mean, life as we knew it is completely different.
Yeah, and Christina, I would love to touch on, and I think it would be helpful for a lot of the attendees to kind of get a little bit in the weeds, but I think it could be really interesting on somebody like you and how you're kind of prioritizing things. So obviously, I would love to know kind of how this pandemic currently, with this pandemic, how are you currently handling emergencies and cruelty? Are you able to respond at the same level of calls? And how are you kind of day-to-day prioritizing you and your team's work?
So we are following the NACA guidelines and have been pretty much since day one. So we are responding to law enforcement assist. That includes our police department, fire, and medics. We are still responding to injured and sick stray animals. Our cruelty and neglect still take priority as well. Bites and anything posing a public safety risk are all still, high priority emergency calls. We are running into, as I said, some issues with our warrants. We've got issues with our police department not just 100% telling us that they will not go into certain apartment complexes that have been, as they call them, ground zero for COVID cases. So, our officers are getting the warrants. The police department's driving around yelling out the warrant over their PA system, and our officers are the ones going through the doors and finding these animals. And it's just a different kind of animal protection.
Well, thank you so much for what you and the rest of your team there in Tucson are doing for animals. And everybody, if you have any other specific questions for Christina, please don't hesitate to drop them in, as we can answer questions at the end. I'm going to go ahead and move on to Shannon Neal. Everyone, Shannon is the Chief Animal Control Officer for Jefferson Parish Animal Services. We have Best Friends has a great and long-standing relationship with the great folks and the great team down there, and Shannon herself. And Shannon, what I really would like to start by asking you is, obviously, you've obviously been officer, but more and more your day-to-day is kind of taking care of teams and leading teams out in the field. How are you balancing the work that needs to be done, how you're protecting your officers during this time? And like, for instance, are you running into situations where officers need to enter homes that have COVID-19 positive tenants, and kind of how you're instructing your team and how you're performing those kind of work? So just love to hear a little bit about that for us.
Yeah, protecting the team is it's a priority of mine, and we have PPE. Everybody has been issued that. We're working from home. We're not responding to as many calls. I dispatch the calls to them. We're using our radios. We haven't had to go in a home yet. If we do have the equipment and protection for ourselves to go into the home, and we will. We're doing a lot of emailing reports. That's really how we're getting our work done right now, is through email. And then we'll go out and post notices after we have the whole report.
That's great. And Shannon, you know, another thing that I would love to touch on that I think could be really helpful for people to kind of understand is just basic things like, and this goes back into keeping your team safe. Like, I want to touch on something as you know, it may feel like in the weeds, but I think it kind of relates to a lot of things like scheduling. You know, how are you balancing scheduling for this time? How are you, you know, dividing your teams or trying to keep with all of the kind of CDC standards and all of those kind of things? Can you share a little bit about that as well?
Yeah, so what we're doing is I'm answering the phone during the day, during our regular shift, and I'm dispatching officers that are closer to the residents that they need to service. And then when it comes to standby at the night, I meet up with them specifically and we switch the phone. And we do that at night and we do that in the morning. And that's how we've been doing it. It's really working great for us.
That's great to hear. And again, same to you, Shannon. Thank you for the work that's going on with your team down there in the community in Jefferson Parish.
Thank you.
You're welcome. The last panelist that we have before we get to Q&A, I want to talk to Dr. Josh Fisher. And again, Dr. Fisher is the director of Charlotte-Mecklenburg, Animal Care and Control. And Dr. Fisher, I really want to get into some areas of, you know, kind of, you know, we're starting to actually hear some rumblings about getting back to normal, which could be exciting. But, you know, we were also struggling as a industry at times of figuring out, you know, and thanks to NACA with those guidelines and what you were all able to produce as a board and leadership there to really help guide us. But I'm interested in two things. One, what advice you would give agencies who are still hesitant to alter their operations from normal even now since this pandemic's happened? And then going back to normal, do you have any thoughts about, should we just be going back completely to normal, or are there some things that we're learning through this pandemic that could change what the new normal is?
Sure, thanks, Mark. So I think to the first part of the question, as far as being hesitant to alter our existing operations away from normal right now, the big thing I'd say there is that this situation is far from normal. You know, we are not operating in any way, shape, or form in our normal operating conditions. So we as an industry have to move and change with that. And what I've heard across the country from organizations that are reluctant to change, a lot of that is coming from the top down. It is not necessarily coming from the individuals that are actually out there doing the work. The folks that are doing the work, the animal services departments, the management within them, the frontline supervisors and the frontline employees see and have a good idea of what needs to be changed. And it tends to be the upper level management and elected officials that are kind of hesitant to go down that road. They like the way the things that normally operate and are hesitant to change that. And so some advice there is to pitch it as a pilot program. You know, pitch those things as short-term trials and make sure that it's clear that you can always go back. You know, we have for a long time operated in this mentality of, you know, well, once we change something, it's permanent, and it's not, you know, and a lot of times we learn as much from trying something and it not working out as we do from, you know, not trying anything at all. So, and then to the second part of that, the idea of going back to normal. So normal for all of us is different, right? Every single part of the country has a different normal. It's a different landscape depending on whether you are a municipal agency, you're a nonprofit agency with a municipal contract. It varies so much in our industry. And one of the big take homes here is that as awful as this pandemic has been, we need to try to see the silver lining and look at it as an opportunity to look forward and look to the future, because good, bad, or otherwise, the landscape of what we do is changing. And this is an opportunity to have done and tried some of the things that have been preached for many years as the best way of doing things. Like, for example, you know, not picking up stray healthy cats, right? If it's a visibly healthy stray cat, why impound it? Why bring it in? Unless it's to sterilize it and return it. And so looking at those things, and while we're operating in this pandemic mindset, trying some of those things, and then being able to use these successes that we've seen and the things that have gone really well during this time of altered operations to help move us forward into the next chapter.
Thank you, Dr. Fisher. So obviously, animal services are amongst the grittiest, toughest individuals in all of animal welfare. But there's obviously a psychological aspect to everything that's going on. And Dr. Fisher, you're a director. So obviously that's a big part of something that you have to pay attention to in your job, and any of us should have to pay attention to with any teams that we're working on, even if it's colleagues or coworkers. So I really want to ask you something, and obviously the doctor's not, because you know, you're a psychologist or anything, but you are somebody that is dealing with this and trying to, you know, keep your team healthy in all aspects. So, you know, with the psychological aspects of officers, you know, how are you kind of balancing priorities and all the things that you're kind of talking about, getting the work done, changing the teams, and some of the things that we're hearing from Shannon, Christina, and Scott? But how are you specifically keeping officers and staff and keeping, you know, keeping track of how their mental health is going?
Sure. So first off, by nature of what we do, people that tend to gravitate towards animal services and animal control in particular are just some of the most resilient people I have ever had the fortune of working with. And as Shannon, Christina, and Scott all said, you know, the priority has to be the health and safety of our teams. That has to be one of the absolute top priorities that we have, because without our teams, we can't do the work. The work just doesn't get done without the people to do it, right? So there's a variety of different ways that I can personally talk about what we've done. And that's starting off with making sure that that communication line is open and it goes both ways. There's anytime there is unrest or unease, it's important from my perspective to make sure that not only is the goal being communicated or the policy change being communicated or whatever we're modifying, making its way all the way top to bottom from the organization, but the logic behind it as well. And then taking the feedback from the staff and from the frontline supervisors and from the management team, you know, hearing what their thoughts are, what they see as the potential challenges, and making sure that we work through that as much as possible. And whenever we're talking about something that is, you know, COVID specific or going into a home, or how should I handle, you know, this call, what level of PPE should I use for certain situations, it is not expected for a frontline supervisor, a manager, or even a director to have all of the answers right then and there. And in this kind of situation, when information is changing constantly, it is so important to be able to say, you know what, I don't know that off the top of my head. Let me take a step back. Let me do the research. Let me call the people. Let me ask the questions, and let me get you the information. And it's important that that information be based in fact, it be up to date, and it be timely, right? So because this is an ever-changing pandemic, this is an ever-changing situation. We are getting new information every day, and especially at the beginning of this, that information was coming multiple times a day even, and recommendations were changing. Things were changing between, you know, the start of first shift and the end of first shift kind of thing. It's important to make sure that we are concise and factual, have the up-to-date information, and then we're getting it to them quickly. You know, we're not getting this information, getting these recommendations, you know, and then passing them out, you know, the next day or the day after, that kind of thing. It's almost real time, right? There's a little bit of lag because it's got to be disseminated, but it is as close to real time as we can feasibly make it. And then the final piece of that, because what I feel like is really kind of the crux of the psychological aspect for the officers, is knowing your team and knowing who you're working with, because for some people, less is more, and for some people, more is better, right? There are officers, and we all know them, that they want to come in, they want to know, okay, here's the bullet points, here's what the expectations are, and they want to get out the door and do their job. They don't want to get bogged down in the this is why, this is how we got to this decision. They want to know expectations. Here's what we're giving you to accomplish the goal. Here's what you need to do it safely, and go. And then there's others that want to have the full conversation. They really want to understand every single step, why you thought this versus that, be able to ask questions, have that Q&A. And it's knowing who's going to benefit from what and trying your best to accommodate that. Because some folks, more information is just going to cause them extreme angst, and others, if they don't have enough, they're going to angst over that.
And I think really good messages in there, Dr. Fisher, for leadership and non-pandemic issues as well. So thank you, and very well said. So everybody,
Thank you.
Thank you, Dr. Fisher. What we're going to do now, everyone, is we're going to switch to some Q&A, and we already do have questions. And please feel free to continue to drop in questions to ask these great panelists that are taking their time to kind of address some of this stuff for us this week. And I want to start with a question that I think would be great for Shannon and Christina. It's the same question, but because you are both working in different parts of the country, I'd be interested for you answering this question for this attendee. And specifically starting with you, Christina, and then Shannon after, what are you all doing if you need to go into a home but do not have N95 masks?
So luckily my department is not having that issue. I had already had a pretty healthy stock of them. I have a specific hoarding task force within my department that I've created due to our high hoarding cases out here. So I was in a pretty good position with the N95s. I jumped on the ordering of all of the PPE pretty immediately because lucky for my team, I'm probably as OCD as you can get. So my officers, I feel that they're pretty well equipped to go in. They're all very well aware of my expectations. I'm pretty open and honest about our communications. We have Zoom meetings every Wednesday. And then when these calls come into us, because again, they are coming into us probably daily, they're coming through our dispatch, who then comes straight to myself and the supervisors underneath me. And then we speak to those officers that are going to go into that home specifically. I'm also working with a county official that is, once I get a name and date of birth, I'm emailing it to him, and I have a confirmed or positive or negative case. So I'm already well aware what my officers are going into or not going into. So I guess hopefully that answers that for you.
Thank you so much, Christina. And how about you, Shannon?
For us, I mean, my officers have equipment, so it's hard to say because we have the equipment that we need for the officers to go in safely if we need to. We're pretty fortunate with that.
So Scott, baby, what would you do if you were in the situation and you're asking to get going into homes, but you don't have N95 masks?
Well, my first thing, Mark, is if there's no one in the home, then there's really no need for the extensive N95s. A cloth mask would work just fine as long as you're not interacting with someone. And if you're only in there to, remove an animal, then you wouldn't need an N95.
And if you did have to go into a home to interact, I mean, say, I don't know, a cruelty case or something like that, what would you advise if they didn't have N95?
Well, at that point, I think you will want to maintain as much as you can the social distancing, the 6 feet, and all the social precautions that one would take. And I think that that's really where it does become an issue, because we are going into those places and having those conversations, and some of them can become confrontational. I mean, people are home, people are, confined to their homes, the tensions are high, and next thing you know, someone calls and says, "Hey, I saw my neighbor beating his dog." We have to go address that. What I recommend, obviously, is the social distancing, trying to diffuse the situation, you wearing the best you got in a situation like that. If you don't have an N95, even a a face shield, a plastic face shield would work. And I know it sounds funny. I mean, I remember the first time I walked into a supermarket wearing a mask, it felt unusual. It's not like walking into a hoarding house, which we've all done. But I think that those are the types of steps that if you are going to be in a situation where it might get confrontational, I would always recommend that face shield as well.
Thank you so much, Scott. The next question I would love to shoot to Dr. Aaron, and it looks like there's 2 questions. And Dr. Aaron, even though there's no evidence of human to animal or vice versa transmission of the actual virus, is it a good idea not to allow people to touch your pets and vice versa because the virus could hitch a ride on the pet's fur?
Sure, so great question. Initially, we did think that fur transmission might be possible, just as the virus can live for some period of time on doorknobs or surfaces. And so we were making some recommendations, specifically around actually bathing of pets. The CDC, though, has now said that this is not a potential source of infection, so we don't have to worry about that. No bathing is necessary. I would call out, though, that social distancing with pets, though, is recommended if you yourself are feeling sick. We actually do have, it's a tiny handful. So like what I can count on one hand, a tiny handful of cases where it does look like infected people have given it to their pets. Keep in mind, this is like 5 total cases out of the enormous number of human cases globally. But because we do have that, it is a good idea if you are actually feeling sick to do separate yourself from your pets, just as you would with other people.
Thank you so much for that, Dr. Aaron. Dr. Fisher, I'd love to start with you on this and maybe get some thoughts from everyone on the panel after. But I'm sure there's a lot of anxiety going on around budget and what's going to happen and decrease budgets. So I have a question. Are any of you, and starting with you, Dr. Fisher, having to cut from the budget already? And if you did, 1 or 2 big items that you think that you'd prioritize in cutting, or would you scale down kind of everything if you had to or were expecting a budget cut due to COVID-19?
Sure. So we are fortunate enough that we are not being asked to cut our budget on the front end. That being said, there is a chance that we will end up having to cut on the back end. So what we're looking at is more of a scale back on certain parts of our operation. One of the things that we are definitely not including in potential for scale back is surgery services. So with the suspension of spay-neuter, we're actually anticipating an increased cost for our spay-neuter line item. So what we're looking at is more along the lines of anything we can do to potentially reduce length of stay and the costs associated with daily care. So we're trying to find ways to push more animals out into foster and reduce our costs as far as the cleaning and feeding aspects of higher volumes in the shelter. And then also looking at what we can do surrounding the intake of cats in particular. So kind of really focusing on keeping them out and bringing them, if we do have to bring them in, bringing them in to conduct the surgical services and then get them back out as fast as possible.
Thank you, Dr. Fisher. And I would agree with that, with Dr. Fisher's assessment of that as well. I think, most of animal services are running pretty vital programming. So we are used to fluctuating budgets or contract negotiations or anything like that. And I would bet that most animal control agencies, instead of looking at 2 or 3 key areas that they would cut off, it would be scaling to the budgets and how they, you know, we're used to kind of rolling with those kind of things. So Shannon, I would love to ask you the next question and see if this is something that you can answer, and if not, I can certainly pass off. But this question says, one of the major issues we are facing is the directive from our county attorney and court system, so from the government, to stop issuing all citations at this time, as they will not be processed during the pandemic. So the courts aren't going to be able to do anything with them. Do you have thoughts or what you would recommend for communicating this policy change to the public while still trying to provide high levels of customer service and trust that has been built?
Well, we're still issuing citations and violations, and we're just doing our court dockets for when the courts do open and they're ready and we get our dates, we can set them according to the cases that we have ready to go. We haven't been asked to stop writing citations and stuff.
And any of the other panelists, even if it wasn't something that was happening currently, do any of you have thoughts on how you would address this question or this situation in this question?
Hey, it's Christina. I guess we're kind of in a similar situation. All our courts are also shut down. We've halted all our civil complaints, which are noise and waste. They've all just kind of been put on pause. But the rest of them, we're still issuing citations on bites or, you know, aggressive animal attacks. What we had to do is extend the court dates, and you know, we may have to reassess them once we get to that point or that date. But it's challenging, but I think still essential in our roles.
Right.
Hey, Mark, if I could interject on this as well, because I actually think there might be a little bit of a silver lining on that. I understand and I totally respect the fact that there are cases where there are times when it's appropriate to issue citations, but I think that in a lot of agencies, it's more of a go-to than not. And they use it for revenue. So they you know, some places even have quotas for issuing citations and so forth. But I think what we could look at in this case is that this may actually force some of those officers to learn how to solve these problems and resolve these situations without having to issue a citation, which is something that, you know, a lot of successful agencies are moving more towards a community engagement model where they're helping people solve problems rather than just going out and impounding animals and writing citations. And I think, you know, NACA, I know, has been preaching that, and we work with officers to try and get them to that point. But I think this might actually force their hand a little bit. So at the end of the day, they might say, hey, this is working. If I don't have to use my ticket book.
Yeah, makes a lot of sense, Scott. Thank you. And I want to tee this up for Scott, you and Dr. Fisher specifically, because you have NACA, and Dr. Aaron, if you have any thoughts on this, I would love to hear your thoughts if you do. This attendee is saying, I do TNR and believe that spay neuter is of all animals, both companion and community cats, may be the most important animal welfare action going forward. How is your opinion changing on that? Have you thought about trying to encourage it more? What is your experience? And I can reread parts of this because there's a lot of questions in here. Shelters in normal times can't hold all animals, and in New Jersey, where I am, many towns don't even have them. Hoping we use this time to discuss the best use of all resources, money, and human going forward. So maybe Scott and Dr. Fisher first. You know, are your opinions changing on the importance of spay and neuter? And kind of, can you talk a little bit more in detail? Scott, you talked about this a little bit already, but kind of how your encouragements and the statements going forward were there, and where your thoughts are in regards to spay and neuter moving forward.
Well, first of all, I don't think my opinion on spay and neuter will ever change entirely. You know, I mean, I think, and I'm a big advocate for trap, neuter, and return programs, shelter, neuter, return to field, all of that. I'm a big advocate for that, and I'll never change the way I feel about that. I think right now in today's environment, because of the situation that we're facing PPE shortages, staffing shortages, where places are saying you can't do essential services. Yeah, I am advocating for releasing unsterilized cats, or not picking them up. And we'll deal with that later, and we'll have to do more aggressive TNR later. But if we bring those animals, and I've talked to shelters who are still, the animal control officers are still trapping those cats and bringing them into shelters where there is no option for TNR. And the only other option would be either those cats live in those cages until they can get sterilized, and that could be months, or they're euthanized. And to me, neither option is acceptable. I don't know if that fully answers the question, but that's where my head's at. And I know it's controversial, and I've been dealing with a lot of people who are adamantly opposed to us saying things like that. But we can't do the sterilization that's needed today, and the other options are limited and mostly unacceptable.
Dr. Fisher, do you have anything to add to that?
Sure. Just very quickly, I'll say that I agree with Scott in that I also don't see my view on the importance of spay-neuter changing. It's the one effective measure that we have found for true population control. So I think that is definitely something will continue in the future. To kind of the point down towards the bottom of the question, I believe, was discussing best use of resources, money, humans, all resources essentially going forward. I think that's a huge conversation that has to be had, and it's going to vary jurisdiction to jurisdiction, municipality to municipality. But one of the kind of key themes is going to be that we did suspend spay-neuter services, and we did suspend TNR services. So for cats and kittens in particular in most of the country, and then in some of the country where there are still, large populations of free roaming dogs, we're going to be looking at more babies this season and probably next season than we have seen in the past, and we're going to be doing a little bit of catch up. So I think that is a absolute discussion that can and should be had and targeted, of how we can use the resources that we're going to have available to us, because to the point of the earlier question, we may have less resources available in totality, to be most effective.
Thank you so much. And I just want to again say, it is National Animal Control Officer Appreciation Week. So to Dr. Fisher, Shannon, Christina, Scott, even though maybe you're not doing it today, you've done it for many years. And for all of you out there that are officers in the field, thank you for the great work that you do. You deserve more of a week of notoriety, but that's what we got. And we just want to say we appreciate you and thank you for what you do. Just in case you're wondering, that week happens always on the second full week of April. So good to know if you are not an officer, but you're working closely with a field services agency, it might be great to just say hello. Thank you for your, what you're doing, even if you're not always in step. Things like what's going on with COVID-19 and this pandemic just really show that it doesn't matter who we are. We're in a field where we all love animals. For the most part, we all want the same things. We might have different views of how we go about them, but we can't do this without one another, and we are certainly all in this together. I want to just remind everybody as well to please, please, please participate in the post-webinar survey. You can see it on the screen right now. You don't have to do anything. As soon as this ends, you're going to be prompted to a survey. We only get better through great feedback from you. For those of you that did ask questions and did not get responses, we did our best to try to get to them, but there was just so much that we wanted to talk about with this great panel. So again, and Dr. Erin Katribe, starting off the panel, Medical Director for Best Friends Animal Society. She will be on these webinars, these weekly COVID-19 webinars every Thursday. And again, they're going to be happening, different subject matter, but because Dr. Erin is so tied into the medical part, the CDC things, and getting a veterinarian voice is so important. You're going to be hearing from her every week that we can grab her in here. So please mark your calendars to attend the meeting next week, it's going to be a whole set of panelists and other COVID-related information. And to Scott Giacopa, Director of Shelter Outreach for us here at Best Friends, Christina Snow, Animal Protection Manager for Pima Animal Care Center in Tucson, Arizona, Shannon Neal, the Chief Animal Control Officer, Jefferson Parish Animal Services, and of course, Dr. Josh Fisher, who again is the Director at Charlotte-Mecklenburg Animal Care and Control. Thank you all so much for your time. Thank you, panelists, for your time and taking the time out of your busy schedules to be here with us. Please come back. Hopefully we'll see you all next Thursday, and enjoy your Thursday evening today. And I hope you all have a great weekend. Bye for now.